Dr. Tabinda to give her comments.
Thank you very much. Thank you. And I'm really honored this morning. It's quite early, but it's now 6:15 here. Thank you very much for the two very good talks. I was really, really impressed by, as usual, by the data that Aisha presented and the talk that Dr. Sadia did.
May I request Dr. Sobia to please kindly give her expert comments?
Thank you very much, Zareen. Brilliant talks by the two ladies, touching base on gestational diabetes and its further, consequences of developing diabetes in future life. I think, as most of our people in question and answer session, they have rightly pointed out that we need to have some strategy for early and more appropriate screening. And with that, it comes to my mind, just like, the mothers are repeatedly taking their children, the neonates or the newly born babies, for repeated vaccinations. So perhaps we may be having some kind of community center, be it at an EPI, to have regular simple checks for mother, which should be very cost effective. Like a weight check, blood pressure check, and even a blood glucose test on a glucometer or a venous sample. So perhaps this is something which would keep up the motivation. If she's losing weight, that would be an encouragement. Likewise, if she's becoming more hypertensive or if her blood glucose is going up, that should be kind of like an alert sign or a warning for the technician over there or even for the mother. And then perhaps at that point an appropriate referral should be made. Because I think it's not easy for a Pakistani mother to go for a medical checkup. At a medical consultation, it takes a lot of time. So one has to bear in mind, especially if one has a newborn to look after and the rest of the household activities to look after. With regards to the psychological aspect of type 1 diabetes, it's an area very close to my heart. And particularly with type 1, at our center, we used to have a psychological assessment of all the type 1 diabetics. And we have practically used the diabetes distress scale over the past 4 or 5 years now. And what our experience is, as these youngsters mature, as they grow up, and from day 1 till year 5, as they have a longer or they kind of like grow up with their diabetes, their distress level, it grows up. It's not that, at the start, perhaps they don't have much idea about the diabetes or the responsibilities that they have to undertake. But with the course of time, their distress definitely goes up, and there are different reasons for that. It may be simply because, at a very young age, they are thrown up the responsibility of looking after themselves. There is a lot of discrimination. The main reason for this stress, it begins from home. I must emphasize that. It's the mothers and the grandmothers and the ladies as house. When the child is sitting at, their dining table, everybody is eating one kind of a food, and the child is forced to eat a parhez. If the other people or the other children, they are having their scoops of ice cream, the child is simply told that he cannot have. Likewise, most of the times parents come and they tell us that they're not feeding their children with fresh fruit. So again, that is something not very positive, and obviously it's not the right approach. So these are the factors which make the child really, really feel very deprived. Beside that, because there's a lot of needle phobia. And then when those children, they go out in the community, especially the schools, they are participating there. So there is a problem of having hypoglycemia, and at times when their diabetes is not controlled, I have come across children that they are made fun of, they are rebuked. It's more of a stigma that because of their osmotic problems, they are kind of like discriminated from the society. So, having a lot of psychological support for these youngsters, that is essential. And maybe in Pakistan, we are far, far from that point that there should be a psychologist for every diabetes care center. But I think the diabetes mild study at Australia, they have initiated that, and there are lots of other centers that are doing that. So
Thank you very much, Dr. Sobia.
I was, as I said, really impressed with both the talks. The problem of gestational diabetes and the follow-ons obviously was very nicely highlighted by Aisha, as always. And I had a couple of comments to make on that. One was, I think that basically the teamwork for both the issues that were discussed this morning is extremely important. And I think that as doctors, we have to branch out and we have to involve people on the grassroots level, like health visitors and people who do have, the patient has more confidence in, and building a knowledge base from the bottom and then bringing it up. So as doctors, we can only do so much. And I think that taking this responsibility upon ourselves of educating and getting it down further down the line and then getting it to the patient perhaps is a more suitable approach for Pakistan. The other issue is of young patients with type 1 diabetes, and we struggle with the same issues as you do. There is some form of discrimination at all levels during sport, at school, but there is a very good system of diabetes educators and diabetes nurse specialists. And I think that unless we develop those kind of things, the discrimination that is there will continue and will continue in its worst forms. So, and having diabetes educators and diabetes nurse specialists and perhaps having joint clinics with psychologists would help. Now, psychology is a very interesting concept, but it is very expensive and perhaps in the long term cost effective, but I think getting it going is a very difficult thing. And perhaps if we could take a multidisciplinary approach to the patient so that the doctor can give time, but the other people who can devolve more time into the patient are also involved, which is the diabetes nurse specialist and perhaps psychologist. So perhaps Pakistan Endocrine Society can come up with an idea that will involve multidisciplinary approach to patients who have type 1 diabetes, and that is the only way forward. There is plenty of evidence that if a multidisciplinary, aggressive or extensive or supportive environment is provided to the patient at the start, at the outset of their condition, in the first 6 months, the outcomes are much better as compared to patients who have less support in the first 6 months of diagnosis of type 1 diabetes. And then there is the issue of people who are older and well adjusted in their lives. They perhaps need less support.
Thank you very much, Dr. Tavinda, for your expert comments. Now I would request Dr. Musarrat to kindly share her thoughts.
Okay, thank you. I think most of the points has been covered, so I won't take much time. Just two comments about the second talk, type 1 diabetes. All of us who are doing clinics with patients with type 1 diabetes, some points from my personal experience. We have more than 1,000 type 1 diabetics registered with us of different age groups. And of course, psychosocial problems are very common, and in this regard, gender plays a very important role. So it's more common in women compared to men. And of course, we know the reasons why it is. So just two things that we have seen is helpful. One is the peer review system. The patients feel more comfortable when they get some positive messages from someone who is having this type 1 diabetes, is going through whatever they are going through. So if those people who are seeing a lot of patients can arrange this peer support program for their patients, it would be very much helpful. And the second thing is the time needed to deal with these patients. Of course, the busy clinicians can't do it. So we have a very nice experience of diabetes educators, especially who are trained with these psychosocial aspects, in whom these patients feel connected. And the third very important thing in our personal experience was a helpline support. We gave them 24 hours helpline telephonic support with the diabetes educators. So these three things have helped a lot in overcoming the problems. As far as GDM, almost so many things have been said. The most important thing that I think in our society, the use of social media is very underused regarding positive aspects. We know social media has got a very strong presence, and patients come to us confirming the things that they have heard from it. So why not have some positive messages using the social media? This can go a long way in it. So thank you so much. Thank you.
Thank you so much, Dr. Musarrat.